Laura and Amy.
Thank you very much, Hannah. So yeah, really warm welcome to you all. I'm Laura Hall, as Hannah said. I'm the programme leader for the Masters in Occupational Therapy. So if you're to join us on the programme, you will see quite a bit of me over the 2 years. And Amy's also here as well. So Amy, I'll let you say hello.
Hi, my name's Amy Cooper. I am the admissions coordinator for the Occupational Therapy BSc and MSc programmes. I don't do a huge amount of teaching on the MSc, but you will see me around, particularly for maybe some pre-placement classes, and also when it comes to the dissertation module as well, which is a bit further down the line. But I'm really looking forward to seeing you all, and hopefully seeing you again in January.
Thank you. So I appreciate that you all probably kind of have an understanding of occupational therapy, because that's why you're here today. And I'm hoping it's something that's of real interest to you. But I guess we wanted to just start by kind of talking about how the programme does help to prepare you for becoming an occupational therapist, because it is a really interesting, diverse, rewarding profession, and one that, you know, I'm really sort of proud of to be an occupational therapist. I know Amy is as well. But I suppose just to kind of set the scene a bit with what the programme's all about, because it is setting you up to become an occupational therapist. And what we do as occupational therapists is all about looking at kind of what people do in their lives, how we occupy our time, to being really fundamental to human health and well-being. And that as occupational therapists, we help people overcome challenges that might be impacting on their lives. So there's so many ways that can kind of come across in the types of roles that we can work as occupational therapists. But what we need is a sort of foundational understanding of physical and mental health, things like how our environment impacts on our activities and our health and well-being, how humans engage in activities and how it can be used to improve our health and well-being. So that is what the programme is about, kind of setting up with that foundational knowledge and understanding. And that this programme, our pre-registration MSc programme, does prepare our students to work as occupational therapy practitioners across a really wide range of health and social care settings that are available for future careers. And this slide is just to give a bit of a sort of an overview of what those potential areas for your future careers could be if you were to complete the programme. You know, I think quite often people might know about occupational therapists because they maybe encountered them in a particular setting, but don't always realise the diversity of where we can work as occupational therapists, that we can work across hospitals, GP practices, community teams, but beyond that, we can work in schools and prisons and nursing homes, day centres, social enterprises. We've had ex-students that have gone off to set up their own social enterprise organisations, third sector, so kind of charity organisations as well. And we can work with a really diverse range of sort of client groups as well. And I guess Amy and I just wanted to share a wee bit about our own practice, because I think it's always nice to hear kind of what you might be able to expect. And Amy and I have actually briefly worked together in practice in the past, but we have had sort of different experiences in our past practice. So I worked for a number of years in different hospitals and with different client groups, and actually looking at the sort of range of client groups that we've got listed there, I've kind of worked with all of them in different areas that I've worked in. When I worked in hospitals, I worked across kind of quite acute medical wards, surgical wards, but also more kind of longer term rehab. I worked in cancer wards for a while. I worked in hand therapy. And then more recently in my clinical career, I worked in a community mental health team working with older adults, predominantly people with dementia. So I got to kind of transition out to the community and do something different there. So there's just so many possibilities when you get this degree of where you can take it. And I should probably say, actually, I completed the MSc pre-registration in occupational therapy at Glasgow Caledonian University as well. And it led me on to that kind of diversity in my career. Amy, do you want to say a little bit about yourself as well?
Yeah, of course. So same as Laura, I also completed the MSc in Occupational Therapy before beginning my career. So undertaking quite a similar pathway to what all of you will be doing as well. So I started within the NHS in what we call a rotational post. And within the rotations, you are placed in a NHS health board, and you can move around different hospitals and different wards or departments within the hospitals. So it's a really good way to get a range of experience. So I started in stroke rehabilitation and really enjoyed that. So I got to stay on for a full year within stroke rehabilitation, and it was really rewarding field to work in, before then moving on to rehabilitation in older people, and again really rewarding, and it's a client group that I particularly enjoyed working with. I then latterly went on to work in a reablement team. which is where you work in the community and you're supporting people to live for as long as they can in their own home, and maximising their independence to do that. So by doing a range of different sort of assessments and interventions to ensure that they can do that safely with minimal risk, and inputting and signposting to other agencies as well. So I really kind of varied career, slightly different to Laura and some of the experiences that we've had, but that's what our teaching team brings to you here at GCU. We all have different backgrounds in different areas of specialties, and hopefully we can give you some, more knowledge in those different areas as you move through the programme.
Yeah, absolutely. And I think, we do have a really diverse team here. We've got people that trained internationally as well in our team. So there is a real kind of diversity of experience you'll hear about from us all if you join us. So we'll move on to talk a wee bit more about the programme itself now. So Amy, I'll let you talk about the entry requirements.
Yeah, absolutely. So as admissions coordinator, it felt right that I chat to you about the entry requirements of the programme. So if you have been onto the GCU sort of prospectus website for the master's programme, you will see that you need at minimum an honours degree at second lower class level, or equivalent for graduates of non-UK institutions. We also expect for that study to have been completed within 10 years of applying for the programme. However, what I will say is if you feel that you're unsure that you do meet all of these requirements, or you're maybe slightly out of the expected entry requirements, please just apply if you are really keen and interested in the programme, because there may be some additional advice that we can give you to progress into the programme, whether that be for this year or a future entry year. Then absolutely please inquire and let us know what you've got, and we can guide you in the right direction for being able to progress.
Thanks, Amy. So I'm going to talk to you a little bit about what you can expect from the programme if you're to join us. So it's a 2-year programme. So it's a sort of slightly condensed in terms of, because we can have students doing an undergraduate in occupational therapy in the UK, which takes sort of 3 or 4 years, but we're doing it in 2 years, and it's over 6 trimesters. So we talk about trimesters at Glasgow Caledonian University. You might have had semesters in previous universities, but we have 3 in a year. So we talk about trimesters. So there's 6 of them over the 2 years of the programme. And I'll tell you more about what happens in each of them in a moment. And the programme starts every January. So we have a new intake of students come every January, and we have 2 kind of cohorts at a time. We have our first and second year master's students. And in each cohort, we have about 40 students that join us. So we offer places to 40 students. So it's, depending what you've studied before, that might be quite small. It might be quite large, but generally we find that most students, it's much smaller than what they had in their undergraduate programme, which was maybe kind of 100 or more students in a cohort, which does mean it's nice, it's quite contained, it's quite small. You get to know the other people in your class. We get to know you all. So it is quite a nice number for us to really kind of build connections over the 2 years of the programme. Something that I know we'll talk a little bit about further in a moment, but I know applicants are always interested to know about is the kind of placement options. So there are 4 placements that take place over the 2 years, and in a moment I'll show you where they happen. And they happen in a range of different kind of health and social care settings. We've talked about how diverse your career options will be, and that means that we all offer a real diversity of placement experiences as well. There is an option for potentially carrying out the final placement of the programme internationally, and that's something we can provide support for. It is something that we can look into for those that are interested in doing that. It tends to just be the final placement we look at, and that's partly just where it falls in the programme, and also just having enough time to plan for it as well. But if that's something you're interested in, we can support you and give you a bit more guidance on that. So to give you a wee bit more on the programme overall, this is, in a nutshell, what you can expect from the 2 years. So like I said, there's kind of 3 trimesters per year. So in your first year of the programme, when you start out, you start predominantly in the university for that first trimester. So you have 3 modules that you're carrying out within the university that's giving you real kind of foundational knowledge required for occupational therapy practice. So we have some core learning of things like skills and processes that are used out in practice. We introduce some underpinning theory that helps guide how we think as occupational therapists. And we also cover things like anatomy, physiology, and health conditions to give you that kind of foundation of the sorts of issues that the people that you'd be out supporting might be encountering. So that's your kind of the bulk of your introductory information that you get in that first trimester that prepares you for what happens over the summer of your first year in the second trimester, which is your first placement. So there is some kind of in-class work that we do in preparation for that. We bring you into the university kind of a week or two before placement starts to do some kind of practical setting you up for what to expect on placement and get you some skills required for that. And then you go out on placement full-time for 7 weeks. And that will be, you'll all go to different health and social care settings to get different experiences of working with occupational therapists and get to put into practice a bit of what you've learned in that first trimester. So students always kind of really enjoy and look forward to those placement experiences. So that's full time for 7 weeks over the summer. You get a bit of a break then when that finishes before you have to come back in September. And what happens in that final trimester of the first year of the programme is you have your second placement experience. So you go somewhere different to where you were in your first one, a different setting, different client group. And that one happens part-time for 10 weeks. So it's 3 days a week for 10 weeks. And then alongside that, you're also in university 1 day a week for a couple of academic modules. And within those modules, you're building on what you've already learned about, and you're building knowledge that you can apply whilst out on placement at the same time. So there you're covering things like planning evidence-based interventions. So what are we actually going to do to help the people that we're there to support, and how can we do that in a way that's supported by the evidence base? And you also have a module that helps develop skills for working as part of an interprofessional team. So in that one, you get to work alongside other students who are studying things like physiotherapy, social work, nursing, other kind of relevant health and care professions to develop your skills, because it's really important when you go out into practice that you can work alongside those other professions. So you get that chance in that module at the end of your first year. So once you're done there, that's year one wrapped up, and you move into year two. And with year two, you will see right at the bottom there, it's got the dissertation that runs along the whole of year two. So that is your kind of master's dissertation, your kind of capstone piece of work that you're doing, but that does run across that whole year. So you're introduced to it at the start of year two, and then you have time to work on it, and you're supported. You'll be allocated a dissertation supervisor who you'll meet with at various points across that year and be supported to sort of produce your piece of work that you'll be submitting as your dissertation. And we have a range of different kind of opportunities in terms of dissertation. Sometimes people are carrying out kind of critical literature reviews or carrying out more kind of analysis type research projects. So there's a range of options available depending on your area of interest and what you're looking to develop your skills in. So that happens throughout the whole of year two. But alongside that, you have some other things that you're working on at more specific times of the year. So at the start of year two, you've got your third placement, and that's another part-time one that runs for 7 weeks. And again, with that, you've then got a module that's running alongside. So you have a module that's looking at ethics and decision-making. So it's developing more of your complex decision-making skills to be able to kind of go out into practice and decide what is the right or not right thing to do for the people that you're working with. So you have that in the first trimester. And then again, what's the summer period of our second trimester of year two? You have your fourth and final placement, which is full-time for 9 weeks. And this is the one that there can be the opportunity to do it outside of Scotland. The first 3, they would take place within Scotland, but this is the one that there is the opportunity to maybe do it somewhere else. So full-time for 9 weeks over that summer period. And then you come back for your final trimester of the programme, and you have one final academic module alongside finishing off your dissertation. And that final academic module is thinking about how to plan interventions, but not just looking at individuals, but also looking at groups and communities, and sort of learning to recognise some of the wider societal issues and how they might impact on our practice and how you can juggle them and make decisions around some of the challenges that the people you're there to support might be encountering. So it sets you up really well across those 2 years to go out to work in a range of different settings. The other things I'll just mention briefly is at the very start of the year, we have an induction programme. So at the start of year one, we have an induction programme where we set you up with kind of academic skills and practical skills required for setting up for the programme. And at the end as well, in the final trimester, we also set up a transition to practice programme where we do a number of different events, sort of setting you up for preparing for your careers We set you up with kind of interview, application skills, opportunities to meet with potential employers, that kind of thing. So we build that in around the 2 years as well. Okay, so we're going to talk a little bit about placement there, but I'll give you a break from hearing my voice and let Amy tell you a little bit about our placement opportunities.
Hi, so yeah, building on what Laura was mentioning there about practice-based learning and how it can be in a range of different sites. So for your practice-based learning 1, 2 and 4, there are will be generally within Scotland, and that can be anywhere within Scotland. We've got a lovely map there of all the different locations in Scotland that you may be when you're on placement. We do have many placements across the Central Belt where we are based at Glasgow Caledonian University, but there are some opportunities to go further afield as well. And we always let students know that travel will be an option and sometimes expected within the programme. There is opportunity for some international placements, and that's something that obviously you can ask some questions about as well at the end. And where will you go? So you could be anywhere in Scotland for placement, but what type of placement sites? Predominantly, we do have a huge amount of NHS placements. As you can imagine, that is where the majority of our workforce are within the United Kingdom. But we also have our health and social care partnerships within each of our local authorities. And we have other placements that are slightly more diverse that we've had over the years, such as the fire service. We've got Bounce Tea, which is actually a social enterprise which was created by one of our graduates, and that is about rebound therapy, so using trampolines as a therapeutic use for the client group they work with. We also have Alzheimer's Scotland, the Scottish Refugee Council, Think Pacific. These are all third sector charitable organisations that we have worked with in the past, just to showcase what we have done before, and it is constantly developing and evolving in different providers that we are collaborating with to provide placement. So some of the charitable organisations in third sectors will be the ones that you will undertake in your practice-based learning 3, which is a role emerging placement, and that's where you get the opportunity to undertake a placement where there isn't already a traditional occupational therapy role. But as students, you go out in pairs or groups to develop a role and an intervention that can have a lasting impact. So you imagine the huge benefit that the organisation is gaining from being able to have something that they can keep and carry on and provide for their service users, as well as you developing those skills, those clinical reasoning skills, understanding the occupational therapy process, which we'll go into in more detail as you move through the programme. But yeah, a huge range of placement sites. So we aren't always, ward-based or, hospital-based. We can, be much more diverse than maybe what people had originally thought. If you had shadowed an OT or spoken with an OT, there's so much more beyond maybe what you have experienced before. So that's our practice-based learning sites. And we'll move on to the next slide. So some quite important points here in terms of who we are accredited by and who we are approved by. So when you come to GCU, why choose us? Why are we the programme that's going to work for you? So we are approved by the Health and Care Professions Council, which you are required to be registered with to practice as an occupational therapist within the UK. So upon graduation and, obviously passing all your modules, you will be able to register with the HCPC and then be given, a membership number that allows you to then practice. We are also accredited by the World Federation of Occupational Therapists and also the Royal College of Occupational Therapists, which is a UK-based accreditor for occupational therapy. So what does that mean? What benefit do we actually gain out of that? So by being accredited by the World Federation of Occupational Therapists, it means that you can practice potentially internationally in other countries. Because we're an accredited programme, you can apply to register in other countries. We can't guarantee that you will get registration in other countries. Please double check the country that you would be interested in working in the future to just check what their requirements are. But we are an accredited programme, and it means that for the majority of sites across the world, you would be able to apply and go through their process. So that is our approvals and accreditation. And next we have, why study with us? So we are as I mentioned, an accredited and approved programme, and that's important. But what do we give? What do we give to our students? Well, actually, over the last number of years, we have been climbing the ranks in terms of our positioning in the university guides, and we are currently number 1 for occupational therapy in Scotland, which I think is a huge, asset to have, and real sort of draw, hopefully, to you students. We have been given that accolade. We are the top 5 in the UK, which again is another really huge achievement, because there is, as you can imagine, a number of occupational therapy programmes within the United Kingdom. So to be recognised as a top in Scotland and placed in top 5 in the UK, I hope that gives you the encouragement that we are a really engaging and supportive university, and students feel that they are given a top quality education in occupational therapy. We are also nominated very frequently for the teaching awards. Every year we have members of staff that are shortlisted for the Glasgow Caledonian University Student Association Teaching Awards, and it is usually terrific teaching and super support. And from all of our student feedback, the one thing that students really focus on is actually the support that's provided here in the teaching team at GCU. So I hope that, again, that encourages you to apply to our programme, or because we will be a supportive and very approachable team as you move through the programme, and terrific teaching. What can I say, Laura? I think we are very, well, I'll say very engaging. That's me kind of blowing our own trumpet.
Why not?
Yeah, absolutely. And we try and make classes and tutorials, as fun and as exciting and engaging for you as students. And we always take on feedback for any changes that we need to make to how we deliver content as well. So,
Yeah, absolutely.
Okay, thanks, Laura.
Thanks, Amy. So I see there's been a question in the chat. If it's okay, what we might do is just come back to that at the end, and we'll see if there's any other questions, if that's all right. But we will not forget about you. But I suppose just on that, in terms of the kind of how we try and make our classes engaging and interesting, it is a master's programme, so there is a level of academic study expected from you. So, you will spend a fair bit of time reading and, hopefully making most of the library facilities that we have on site at the university here, and, doing your own work. But it is also a programme that's designed to get you prepared for going out and working in what is a very practical and sort of hands-on and people-focused profession. So we also have a number of activities built in to our modules that are, outside of placement, that do have a number of sort of practical elements to it. So pictures here are just to give you a bit of a snapshot of what that might look like. So the top left is kind of within a classroom, sort of roughly what you can expect, in terms of one of our classrooms that we use. But the students there are watching a video case study. So we do use a lot of kind of practical real life scenarios for our classroom teaching, just to try and connect the theory and the sort of the research that you're reading about to what that actually means for real people. So there's a lot of experiences of that kind of using real life case studies and videos to make those connections. But we also do manage to build in, getting out of the classroom at points throughout the programme as well. So the top right is a field trip that we get to go on every year, and I'm hoping that we'll be able to continue that in the coming years, which happens in year 2 of the programme in the ethics module, where we go on a field trip out to the Scottish Fire and Rescue Service and get to learn there about kind of how we can look at risk within people's homes when we're working with people, particularly thinking about fire risk, but we think a bit beyond just the fire risks when we're working there. And you get to sort of learn about how we can work jointly with Scottish Fire and Rescue Service as well, to try and minimise risk of fires in people's homes. So it's always a great day out that our students really, really enjoy. I really enjoy it too, to be honest. I've got to go on it the last couple of years. I think, Amy, you've been on in the past, and it's a really interesting but fun day out as well. And the pictures at the bottom are of some of our students out assessing our campus. Get a bit of a snapshot of our campus, looking at accessibility for people with different kind of needs, so particularly kind of physical disabilities, looking at how bathrooms or the external environment might suit. So developing skills for looking at environments and thinking about how we can adapt environments to suit different people's needs, depending on their own individual requirements. So there are those kind of practical elements built in to our modules as well. And this is just, I think, well, because we're very proud of our students, this is a bit of a chance to kind of share some of their successes as well, but give you a bit of a flavour of things that you might be able to get involved in. So these are a number of kind of student news stories that we've had over the last kind of two to 3 years, of students that we've had that have got involved in a number of different initiatives, sort of shared their stories and experiences through our student newsroom. So we've had a number of our students getting involved in things with Royal College of Occupational Therapists, which is our kind of professional body in the UK, getting involved in forums or some of their sort of marketing campaigns that our students have been fronting, which has been great. And we've also had students getting involved in things like, so in November every year, we have Occupational Therapy Week in the UK. So we had one of our students getting involved in a sort of online discussion forum that took place that was attended by hundreds of people. And our student that did that, Rochelle, she did a fantastic job of representing the student body there. And other kind of opportunities that our students get through placements that they have or through working with us, or things that we're doing modules, but also those wider opportunities that we will make our students aware of things that they can get involved in, that just gives you that chance to build those wider kind of communities and connections and set you up for your future career. And obviously give some great things for your CV as well when it does come to applying for jobs. So there's lots of opportunities, and we're really happy to kind of support our students and make them aware of what those opportunities might be, and sing your praises once you've done them as well. There's lots of chances for things like that. And this is just a little bit of a kind of flavour of some things that our students have said. And we've maybe kind of already kind of alluded to some of this and things that we've been talking about, but I think it's always useful just to give you a bit of a sense of, things that our students might say about the programme. So we have a lot of people that move to Glasgow for the programme. So, or maybe move from outside of the UK or from another part of the UK to come here. And where the university is based is really in the centre of the city of Glasgow. And, our students do really like that, how close it is to lots of things. That first comment about the culture, different people, nightlife, art, stuff, lots of things that are kind of really on their doorstep when they come to the university here, being a real sort of bonus for them. But also things about the programme itself, that it's modern, it's focused on preparing you for your future career. It's not just about, can you parrot this information back to me, but more of how is this going to be applied? And that's very much how we try and teach, because we are trying to prepare you for going out into the complex world of health and social care and being able to make decisions for yourself. So we really need to prepare you for that through really kind of engaging teaching methods. Also people commenting things like moving to a new place, it can be challenging, but because, like I said earlier, it is quite a small programme. So people do form really kind of good friendships and connections as part of the class, and also get to know us well, and the support then that we can offer through that. We really do care about our students, and it's nice to see like a comment like this, that comes across to our students, that we are there to support and guide and help you be the best that you can be throughout your time with us and beyond. And then the final comment there, but the coursework is very interesting, it's broad, diverse, covers a lot, and has made me really confident in going into the profession of occupational therapy, which is obviously what we want. That's what we want to hear our students saying, that we have prepared them for that, and the opportunities that their career is going to present to them. So hopefully that gives you a little bit of an idea of what you can expect from joining us. So all we've really got left, we're going to come on to answer any questions that there are in the chat now, but I'm going to leave this slide up for a wee bit, because it does just give you our contact details. We have, there is the sort of generic admissions contact that you can, if you have inquiries, but we also have our own shared mailbox within the occupational therapy team for our master's programme. So that's noted at the top there, the MSc OT pre-reg admissions at gcu.ac.uk. So feel free to take a note of that. It's Amy that predominantly keeps an eye on that mailbox, but I also help out with it as well, and some of our other members of our team. So if you have queries about the programme, if there's anything, in preparation for joining us that you're unsure of, feel free to reach out. If we can't answer your question directly, we'll be able to signpost you to who might be able to. But if it's about the programme, there's a good chance that we'll be able to kind of help answer your queries that you might have. And you can also, if you're interested just more generally in kind of things that are going on, we are on social media. So you can follow us on Instagram or X, or we also have a blog that you can sign up for to follow, to find out a bit more about what's happening at GCU, which I know, particularly if you're moving from somewhere else, but I think even if you're, Glasgow or Scotland based, it's still a big thing to make this sort of change from what you have been doing in your lives and in your careers, or what you've been studying before. And I think it's always good just to kind of be able to know a little bit more about what's going on and what you can expect and who you're going to be kind of getting to know when you're there. So we can use our social media for that. But hopefully that's given you a bit of an idea of what you can expect from the programme. And we are really happy to answer the questions that there are. And if there's any more questions that you want to post, feel free to do that. But I'm going to leave up the nice picture of Glasgow as well, because it is a beautiful city. If you've not visited, then it is, it is a really lovely place to live. There's lots of real benefits to it. So hopefully that gets you inspired to come and join us. So I'm just going to flick back in the chat now. Amy, you're maybe ahead of me.
Yeah, so we've got a question that's came in asking a bit about placements. There's a few questions within that. So we'll maybe start with the first part. And that is, are we responsible for finding our own housing for placements outside of Glasgow? So yes, you are responsible for finding your own accommodation if you are in a placement that requires relocation. We do have a list of some housing providers that previous students have used. That this is not a list that we have approved. It is just a list that other students have collated for future students. So there is a list to kind of help you for certain sites that are maybe more commonly used, but really it is ultimately your responsibility to check out that accommodation and to make those decisions in terms of where you stay. Any add to that, Laura?
No, I think the only thing is it's a good question, and we know it is one that students can want to know more about. But like Amy says, we do have that list that we can share as a guide point. And you may well get that opportunity to move somewhere else, but a lot of our placements are commutable, so it's not necessary to relocate for all of them. It's it might be kind of one placement that you might be kind of looking to do that for. So a lot of them are, because of where Glasgow is based within Scotland, there's a lot of kind of towns and other cities kind of within commutable distance. So actually a lot of our placements are nearby. But if you are looking to relocate for a placement, then we have that information available. The odd placement site has kind of on-site accommodation. But
like teaching hospitals sometimes will have like nursing accommodation that can be used for students.
But for other ones, then we have that list available.
So the next question in that was, will placements be assigned at random, or will we have the opportunity to select the ones we are most interested in? So at GCU, we have a placement team that allocate all of the placements. So they are allocated at random, and the real kind of a priority is to make sure that students are getting a varied experience, and we try and make sure that our placement coordinators will make sure that you have kind of a range of experience in different setting areas. So I suppose if students were picking where they were only interested in, then you might miss out on some of those other experiences that you wouldn't normally have chosen for yourself. But also just in terms of the logistics of all students picking their own placements, it could become really difficult, and also making sure that we were, being fair to everyone and getting their choices. So for that reason, we keep it randomised. We do take, there are some considerations when allocating placements. However, for the most part, it is randomised. Laura, I don't know if you want to add anything to that.
Yeah, I think the only thing is almost more from my own experience is actually sometimes I think people can have quite a set idea of what they want to do and where they want to work. And if that's true, we will take that into consideration, but we can't, absolutely guarantee. But actually sometimes it's the placement you didn't know you wanted that ends up being the one that you get the most from. So I think sometimes actually that kind of, being allocated, because we do try and give that sort of diverse experience across the 4 placements that actually I know myself, but I know of other people I've spoken to as well, that it's like, oh, actually I wasn't sure about going there, but I loved it. And now it's opened my eyes to a whole new area of practice. So
I was the same, Laura.
Yes,
when I was at university, I thought I wanted to do paediatrics and had a paediatric placement, and I did enjoy it. But when I also had a placement in stroke, that was just, I loved it. I just loved the different, elements of it, working with adults as well. And I think I didn't know that was something, you don't know what you don't know. So absolutely, I think
you can get a real diversity across those 4 different experiences, and the chances are you will get something aligned with, the client group that you might be interested in. But we can't absolutely kind of guarantee that you will get a pick of that, but we will kind of look at what we can do to distribute them across the whole group as best we can. So hopefully that answers your question there. But if you've got any more you want to know about, please feel free to add more in the chat. And I see we've got another question that I can take to do with the is there an official summer and December break? I'd like to know if students will have enough time to rest before starting new semester. Yes, there is. I didn't specifically outline the dates of the breaks, but yes, there is. At the end, so you start in January, and it's quite full on kind of January through to, the first placement in the first year. But once your first placement finishes in around kind of August time, you have a number of weeks off before coming back in September. So there is a reasonable break. It's not as long as you may potentially have had in your undergraduate degree, but the students can still get about kind of 4 weeks off. The one exception to that, which we won't dwell on too much, is if you had any module to resit, that might also be fitted into that time. But even with that, there is still some time off before you come back in September. And there is also a break over December. The university shuts down for about a week and a half over kind of Christmas and New Year period. So you do get some time off then, where you're not expected to be attending classes or anything. So, and if you're an international student, there can, if you wish to, there can be opportunities for returning home during those breaks as well. And we give more guidance on that in terms of visas when you're with us. But that is, some of our students do choose to stay in Glasgow and some choose to go back. But there is certainly time to get a rest before starting, over that December period, before then coming into year 2. And it's a similar thing at the end of the summer placement in year 2. There is, it's a wee bit shorter, but there is some time off between the end of the final placement and then the final trimester of that. So there are breaks built in. It is a wee bit more intense potentially than an undergraduate programme might be when there's quite a long summer break. But there are still breaks built in. So there is a bit of chance to rest and recuperate before carrying on, and it is important to make use of that time, because it is, it's a really interesting programme, and obviously Amy and I both did it, and in different forms as it was at the time that we were students. But, it is, there can be times you have to work quite hard, but there are also times when you can have a bit more rest and recovery. And it is then great just to get it done in 2 years and get out into the world of work as well. So
absolutely. There's another question that's come in about, are the assessments a mix of assignments and practical? So I'm going to maybe direct this one to you, Laura, because you know more about the modules in the master's programme.
Yeah, sure. Yes, there is a mix of different forms of kind of how you're assessed. Because it's a master's programme, there is a certain level that's required in terms of your academic modules. And there is a reasonable amount of written work throughout it that's to preparing you for your dissertation in your final year. But there are also other forms of assessment that you're doing. There are some verbal assessments, there are some presentations, there's some kind of vivas. It's more a sort of assessed question and answer session. There are online tests as well, so more sort of testing knowledge, maybe short answer questions that you're doing through tests. So it's a mix of different assessment types across different modules in the academic modules. What I will say as well is what can be a bit of a change for some people, depending where they studied before. There's usually kind of 1, maybe 2 marked assessments per module, which might be a wee bit different if you studied somewhere that had more ongoing assessment. But we give you lots and lots of support. There's lots of chances to practice and get feedback and prepare you for submitting maybe an essay at the end of a module, if that's what it is. The other thing that you're assessed on is your placements, and that's much more of an ongoing assessment. So whilst you're out on placement, you have an assigned educator that is usually the occupational therapist that you're working with there, and you have certain kind of tasks and skills to demonstrate and achieve, and they'll be assessing your performance of that as you go along. But that's a really kind of collaborative, interactive thing where you know exactly what's expected of you. They'll set out, okay, this week we're going to aim for you to be doing this. You'll work on that, and then they'll kind of at the end mark you accordingly of how you've got on with all of that. So it is much more kind of practical assessment for the 4 placement modules. And they're actually assessed at undergraduate level as well. They're not, not having to demonstrate kind of master's level thinking in the placements. You're just doing that at the undergraduate level. So there's a real mix of different forms of assessment across the 2 years to prepare you for different skills required for your future careers as well. Okay, fab. I see another question about are there labs or tutorials we participate in? Okay, so yeah, again, maybe sort of 2 parts to this. I'll answer the first part in terms of labs or tutorials. Yes, there's lots. For most modules, there'll be kind of a weekly lecture where you're getting more of that kind of information presented to you need to know about. But then the bulk of your time in classes is spent more in kind of tutorials, practical seminars where you're doing something with that knowledge. So within the campus, we have a simulated home environment. So it's a kind of pretend flat and a simulated ward as well. And so you have some practicals in those areas where you're almost kind of, imagining that you're working in those settings with patients and maybe learning about anatomy or learning about different skills for practice within those kind of real life settings. But even within the classrooms, we have a lot of kind of practical things that you can be doing within tutorials, thinking about those sort of case studies and applying knowledge. So there's a real mix of different sort of experiences that you can have throughout the different classes in the modules. And it varies module to module depending on what you're learning about. Sometimes you'll spend more time in the simulated environments and sometimes a bit less. But, there are always chances to sort of, for more, we do a lot of small group work, lots of really you having to think about and applying the knowledge that you're gaining to learn for yourself how to make sense of it and how to fit it to the real world. So there's lots of that going on. And then the other part of your question, if you were to take your practice back to Canada, yes, do we assist with and support with the CEES process and licensing? Yes, we've had a lot of students go through that. And we are still, I'm still in contact with students who finished in January of this year who are kind of just getting to the later stages of that process. So yeah, we do offer a lot of support and guidance with that. We are only required to, in terms of formally the programme gives you the ability to register in the UK, but because we have a lot of students that do go to work in places such as Canada, we do have a lot of information from previous graduates that have gone through that we share with you. We can connect you with previous graduates and we will support you with that. We've actually just had one of our team visiting Canada and also meeting with CEES there for looking at kind of just streamlining our processes with working with them. So yeah, there's lots that we can do with that. So it does obviously take a wee bit longer going back to work internationally, because when you finish the programme, you can almost immediately register with HCPC to work as an occupational therapist in the UK. That happens very quickly. The process for other countries varies a bit in length of time, but for Canada, we have kind of managed to speed that up a bit in recent years for our graduates that are going back to work there. So yeah, lots of support to help you with that. And we've had lots of students successfully do that. And just actually before I move on, I've obviously talked a bit about Canada there, but other countries that we've successfully had students going back to in recent years has been the US. We've also had a number of students from Hong Kong that have gone back to there. Ireland, yeah. Say that again, sorry, Amy.
Australia as well, sorry.
Yep. So we look at who we've got in our student body at the time and what support we can offer them depending on where they're looking at going. So there's other countries and we're always expanding it. We've got a number of students at the moment from Nigeria. So I'm at the moment preparing kind of to support them for getting to the end of their programme as well and getting their registration there. So lots of places that we can support with as much as we can, but it is still kind of on individual students to sort of follow that process. We can't do it for you, but we will support where we can.
Yep.
Okay, I'll move on to the next question. We're going back to some placement stuff, which is absolutely grand. So when do we find out where we're placed for placement? Do we have some time to find suitable accommodation, etc.? Amy, do you want to, I know you've been involved in a lot of that. So.
Yeah, we try and give you as much notice as possible. If you are someone that is going to be relocating, we will try and let you know as soon as we have got that placement secured and to give you plenty of time to try and find accommodation. So it is a number of weeks. It's not months, just to kind of be realistic, it is usually around about kind of 4 weeks in advance we would give you to try and locate that more if we can, if we have the that offer coming in earlier. But we wouldn't be allocating a last minute relocation placement because it would be unrealistic to expect students to find accommodation. If it's not for relocation, for standard placements, again, we do try and give you as much notice as possible, even just from the perspective of figuring out what your commute is going to be like for getting to placement. So we do try and give you a number of weeks notice, and it really does depend on the kind of time of year and what the kind of landscape of placement offers are looking like for us. But as soon as we know, we let you know so you can get things organised. And yeah, we wouldn't be giving you like a week's notice to try and find something.
Yeah, thanks. I'm absolutely delighted with how many questions there are coming in. It's great to see lots of interest in what we're doing. So I'm just working my way down. And also, actually, I meant to say earlier, because I clocked in the chat at the start, some of you got up in the middle of the night almost, or very early in the morning, at least, for joining us today. So thank you so much for doing that. It's great that you're here with us. So I'm going to go on to the next question then, which is about induction week. Is there an induction week prior to the course commencing for master's students in January? Yes, there is. So what I might actually try and do is pop the...
I've got the dates here, Laura.
You've got the dates there, fabulous.
Yeah, so I've got the dates for induction, but I can also post a link to the academic calendar as well.
Yeah, I wonder if you wouldn't mind doing that. That might be good. So the academic calendar is just the wider GCU academic calendar, so it gives you a bit of a sense of dates. There is some variation, so prior to you starting, if there's anything you need to know about, or certainly once you started, if there's any changes, we'll let you know. But we do start in line with the dates that are listed there for January. So there's an induction week, which I think is the 20th of January, it starts. And we do plan a number of different sessions for you in that week, which actually kind of links with the next question in the chat as well about international student orientation. So we have kind of, for our whole cohort, the sort of around 40 students that we have joining us in January, myself and my colleague, Ro Harrison, who's our year one coordinator, plan quite a lot of different sessions and activities to give you information, set you up with what's expected on the programme, with getting you orientated to the university, or to the sort of IT systems. All that kind of stuff is built into that induction week. So we do really encourage students to come along to that if they're able to, because it is a good chance to start getting to know your classmates, getting to know us, and just getting set up with some of the kind of just the sort of how to study, where to go kind of thing. So we do have a number of things planned within that. And there is also some support for international students. So I'm kind of linking into the next question. Some of that is done kind of more widely as the School of Health or the university. For our international students, you'll be sent out links to information to support you with kind of getting set up and established. Lots of just the practicalities of moving to a new country. So you do get a lot of that sent to you via email before starting. But we do also incorporate a bit of that into our induction week, because we recognise that we have people moving from a number of different places to come to Scotland. So we do always have a session in induction week that's a bit of a chance to talk about, kind of issues that you might be encountering and ways to overcome them. And we often, what we'll hopefully be able to do is get some of our existing students to come along to some of those sessions as well. So you get a chance to meet some of our existing students and ask them questions and find out things that you might be having some difficulty with. So we're definitely there to support you with all of that and get you set up before your modules properly start the following week, so you've had a bit of time just to get yourself set up and established. But even if you're not relocating, there's still a lot in induction week that's probably helpful just to get you back into study if it's been a while, or getting used to studying at GCU if you've come from elsewhere. So yes, we will. What we'll also do, actually, I'll just say on that, is once it's confirmed that you're intending to come to study with us, I mentioned my colleague Ro Harrison, she emails out all our kind of new students sort of before they start. So usually around kind of November time, she sends out an email that's got a bit more detail of induction week and things that you need to be doing in terms of getting ready to start. So we'll share all of that information with you in advance so you can plan for that. So you can look out for that if you are planning to join us. Okay, we'll go on to the next one, which is another one about placement. And will part-time placements be within Glasgow? And my answer to that is sort of yes-ish. I guess
sometimes.
Yes, But the issue is really because Glasgow is a big city, but then it kind of almost sprawls out to other places that are not technically Glasgow, but that are close to Glasgow. So the part-time placements that you have where you've got modules alongside, we do try and make sure they're ones that people don't need to relocate for. That is maybe how I'll express it. We don't tend to have them away in the Highlands and Islands or down in the borders. They're usually kind of closer to Glasgow, but they may not be within the actual city of Glasgow. But there's there's places that are just outside the city boundary that are still very easy to get
commutable.
to. So yes. So it's just a bit of a caveat with that, I suppose, because it's just how you define what Glasgow is, because it does kind of sprawl out to other places that are not classed as Glasgow. But we do take into account that for those part-time placements, it's not realistic necessarily to expect students to be commuting back for classes a day a week. So they're usually the more commutable ones that happen when they're part-time, and the ones that you're more likely to be asked to relocate for would be the full-time ones that happen over the summer, generally speaking. Does that seem fair, Amy?
Yeah, the only thing I was going to ask, but I think this happens more so in the undergraduate programme, but not to say that it wouldn't happen in the master's programme, is that sometimes we do a hybrid learning for the modules if the placement offers are predominantly further afield, whether we are having to have people relocate. I'm not aware that that's happened for the master's.
We haven't required
students,
to do that for the masters.
I think
We've generally been
the
able
volume
to get everybody.
of students that we have in the undergraduate programme.
Yeah, we have a lot more students in our undergrad, so it's more tricky to juggle their placement sometimes. But our masters being that bit more contained, it's usually.
If it were to happen, though, we would give people the option for the days that your modules were running for you to do them online rather than having to commute back to Glasgow and then back to wherever your relocation site is. So, but it's we're not going to say unlikely, definitely not, but unlikely that will happen. For
but no, it's a fair point. Actually, who knows? The things can always change, can't they? But yes, that's generally what you could expect.
Yeah.
Okay, and then the next question is about physical textbooks, or is there online versions available? We are actually planning another kind of webinar if you're interested in coming along, but if you don't, Ro will send this out as part of the information that she shares prior to you joining us. But we have a list of kind of recommended books. We don't have a set list of required textbooks for the programme because there's just such a range of different books that we use for different things. But a lot of them are available as online versions through our library website. So students can get through the programme without necessarily buying any textbooks, either by accessing them online through the library or borrowing hard copies from the library. So that is possible. Some people do choose to buy certain ones if there's some that you particularly like. But what we will share with you in kind of the coming weeks is a bit of a list of what those recommended books are. There's about 10 of them. And what we'll do is we'll note whether they're available as online or not. If they're not available as online, that's because of how the publishers have made it available. It's not because our library hasn't paid for it. It's just because it's not actually available through the publisher. So there's the odd one that you might think about purchasing if you want to, but you don't have to. You can just use the library for that if that helps, because we know that these things are not always. The library
usually has quite a number of copies of the books anyway, where there's no e-version available.
Yeah, but most of them are available online, so it's only the odd one that's not a possibility for, so it's not usually too big a challenge for our students. Okay, the next question for the placements: how many hours a day is required for the programme? So that's maybe
it depends on the placement site, really.
It depends. It's usually what you're doing is working what the occupational therapist in that setting would work. So quite often it is a kind of a 9 to 5, sometimes a 8:30 till 4:30, sometimes an 8 till 4. For a lot of settings, it will be that. But there are other places where it might be different. I think particularly the third placement, the role emerging one that Amy talked about, that are in different settings. Sometimes you're in schools, so it might be more kind of school-based hours, or you might be working with children who go to after-school clubs, so it might actually go on past 5 p.m. because that's
a later start as well.
Yeah, later start and a later finish. So it really does depend on the service. So there's not an absolute definitive answer. A lot of them are a kind of Monday to Friday, 9 to 5-ish, but there are variations in that.
Yeah, a 7 to 8 hour day is what I would expect. We don't do 12-hour shifts in occupational therapy here within the UK. So don't be expecting shift work, because that's very highly unlikely you're going to see that within any of our placement sites. So yeah, between 7 to 8 hours of a working day is normal for occupational therapy in the UK.
Yep. What I will just say on that is if we have students who maybe have caring responsibilities, they have children, we do ask you to share kind of some of that information with us before we allocate placements, so that we can take things into account. If there are individuals with particular requirements, that we might then not put you in the one that goes on till 6 p.m. if that's not going to suit, but that there does have to be specific kind of reasons and requirements for that, but we do take that into account. So if that was a challenge for anyone.
Yeah, absolutely. Just linking on to the next question, which is also about placement. Is there a set number of clinical hours? Well, we do have a requirement for students to undertake 1,000 hours of placement by the end of the programme, and that is sort of set by the World Federation of Occupational Therapists, that we have to have our 1,000 hours for approval. So you will undertake 1,000 hours at a minimum. Some people might be slightly over, but no one will be under that. You all have to have the 1,000 hours. So that will be your overall.
Yep. And it usually is fairly consistent per placement, but there might be slight variation that somebody might, there might be a public holiday in one setting that wasn't in another, but then we'll make sure that you make up those hours. So by the end of the 2 years, that you will have covered the 1,000 hours that is required, and that is required kind of internationally as well. So it does set you up that you will have that 1,000 hours to look at getting you registered. So yes, we definitely have that minimum requirement that we make sure that everybody meets. And we work with you to kind of, so that you know what that's looking like, so that we can, kind of if you need to make up any time that might have been lost, but we try and avoid too much time lost that's being carried.
Absolutely.
Okay, and I think Amy's posted a couple of things in the chat. So the final question that's in the chat at the moment, is there a part-time option for the MSc in Occupational Therapy? And unfortunately, there is not a part-time option at the moment. It is a full-time programme. Just the nature of how it is designed, we're not able to offer a part-time option just now, unfortunately. So if you have concerns about it and you want to discuss it, if you've got particular needs, feel free to email the email address that's listed on the screen just now if you want to discuss that a bit more. But if you're looking for part-time, then unfortunately we're not able to offer that. Oh, and another question has popped in. So for the in-class modules,
one more, Laura, as well in the Q&A box.
Sorry, I had.
Chat, so
you're right. There is a wee red dot. I had missed it. Yeah, well, yes, well spotted, Amy. Thanks. So I'll just come to the one in the chat just now before I move over. But apologies if you've been waiting with one in the Q&A. So for the in-class modules, what do the hours look like for time spent in class? It does vary a wee bit between modules, but usually for a lot of them, it's a 1 hour lecture and then a 2 hour kind of tutorial or seminar that you might have. But there are modules that have some additional kind of practicals or other things. But it's usually about kind of 3 hours a week per module in class. Some of them are, one of the modules in your first trimester, there is more than that. It's a heavier weighted module, so it's got a bit more to it than that when you're doing some more practical stuff, as well as the sort of the seminar that there is. So it does vary a little bit, but that's roughly, what it might look like. So if you're on campus for a day of classes, you could expect kind of maybe 3, 4, 5 hours potentially in classes on the day. Some will be a bit more, some will be a bit less, but it'll kind of balance out across the time. So, but there's quite a lot of time where you don't have timetable classes in some of the trimesters, because there is a lot of independent study required, and it is a full-time programme. So even if you're not timetabled to be somewhere full-time, you'd be using that time in a way that suits you for your study to keep up on things. So hopefully that helps. Do feel free to post if there's anything else.
I was just going to add to that, Laura, for
yes,
the days that you are on campus for classes, sort of anticipate that your classes could be scheduled any time between 9 and 5. So just for those that maybe do work part-time, that you could be in class till 5, and actually quite a lot of our tutorials are maybe like 3 till 5, or they're like 9 till 11. So just so that you've got that kind of pre-planning for how your day may look. And it will change trimester to trimester, and you'll have a kind of set time of when classes are that you can then plan from there once you get your timetable.
Yep. Yeah, absolutely. So apologies for the one that I had missed in the Q&A, but well spotted, Amy. So what are the age groups of past students? And it's an interesting question. And what I would say is it's easier to define the minimum because everybody has to have a prior degree coming into it. So everybody is kind of minimum kind of 21, 22. And we definitely get people coming straight from their undergraduate degree. So they are at that kind of early 20s sort of age. But the maximum, it kind of is, we've definitely had students kind of into their 50s, I think, in the past, maybe not too many, but we certainly, I'd say the bulk are in their 20s and 30s, and we have a number usually in their 40s, but it can be a really wide range. So don't be put off if you're thinking, am I too young or too old? We have a real diversity, and that's part of what I really love about teaching on the master's programme is the real diversity of backgrounds and experiences, and that we have people of different ages that are all kind of contributing and sharing their ideas and experiences within class. So it's a really, really broad range. We do get some people coming back after a whole career in some other area that have they've just had this notion to be an occupational therapist and they're finally kind of fulfilling that at a later stage. So yeah, wide range. And so can we provide an MSc OT handbook? We do certainly have a handbook that's shared with our students once they're kind of signed up and ready to join us. There is some information on the website. There is a sort of descriptor, I suppose, of the programme that has a wee bit more detail. It's not always entirely obvious where to find it on the website. So I might see if I can just pull it up so I can give you a bit more specific instruction on that rather than trying to do it from memory. If you...
I have the generic page, Laura, the MSc page that I've posted to the chat. But
yeah, thanks, Amy. And then within that, in the What Will You Study, it's got download the programme specification. So if you click onto that, there's a document you can download that gives you a wee bit more detail of the programme. But there is something that's more of a sort of student handbook that you get once you start with us as well, but slightly different to that one that I don't quite have for the January start yet. I'm kind of working on that in preparation for the students joining us in January. It gets updated every year. But yeah, thanks, Amy. Shared it in the chat there. So hopefully that helps. Yeah. So that's us at an hour now. So really appreciate everybody's time and being here today. And I'm really hoping that that's been helpful and given you some information. We can hang on for a few minutes if there's any more questions that MD would like answered, but I'm not seeing anything else coming in just now, so we can give it a moment. But great, thank you very much. And thanks all for your engagement. It's been really lovely to see lots of questions being asked and just nice to know that people are interested in the programme, and really hope that we'll be seeing you in January. And if not this January, a future January, but I'm really hoping that some of you will be able to come and join us soon. But the email address is there. So like we said, if you get any more questions, please do get in touch and we'll be happy to help you out. But otherwise, good luck with them hopefully preparing to come and join us in January. Thanks, everyone.
Looking forward to seeing you, hopefully.
Yeah, great, fabulous. I think we'll just hang on for a moment in case anybody's got a question, but otherwise you're free to leave us now. So thank you. So, yep, so I just see there's a question just about the webinar recording will be sent out. Yeah, it will be shared with you. Hannah's actually had to leave us, but she's going to coordinate that and make sure it's sent out to you, so you can look out for that. And I think she has to kind of process it and add subtitles and various things, so it might not be today, but that will certainly get shared via email with you in sort of coming days, so you can look out for that if you want to go back to anything. But as I say, we're also here to answer questions if there's anything else. Fab. Thank you, everyone. I'm presuming most people have left us, but we'll hang on just for a moment in case there's anything more. And as I'll say, there's now another meeting happening in my room, so apologies if background noise, but I wonder, Amy, I think that's maybe us?
Yeah, I don't see any other questions coming in, and there's nothing in the Q&A.
No, fab. All right, well, we will end it there then. Great.
Right, thanks everyone.
Thanks, Amy. Right, thanks everyone. Bye.
Bye.